Back to the capital, the Nairobi City County government has denied claims that women are being detained in public hospitals over unpaid maternity bail, saying there are delays in waiver processing. Nairobi County Governor Johnson Sakaja, who appeared before the Senate Health Committee to respond to concerns about the broader health infrastructure gaps in the county, said there is a clear waiver guideline, even as he urged residents to register for the Social Health Authority. Kamche Menza has this report.
Why don't we allow?
Appearing before the Senate Health Committee Thursday, Nairobi Governor Johnson Sakaja dismissed claims of detention of women at county health facilities, saying delays in waivers should not be mistaken for detention.
State the total number of women detained in the hospital facility due to inability to settle maternity fees, stating the respective amounts owed, state the payment modalities.
We don't detain women in facilities. It is the waiver period and process that takes a bit of time. And that is what we are refining. Because you find people ultimately, and you've been a governor, facilities cannot run if payment is not made. And that is why we tell people, please register on SHA.
The committee was probing circumstances that led to a patient's death and broader health challenges in Nairobi's public health facilities.
It was a very sad incident to have a 23-year-old woman who's from Kangema but living in Nairobi die while giving birth in this day and time.
If the theater was in use, why did you still keep on holding her until the theater was free for use? Because, Chair, from what we are observing, it's like the management was just reluctant.
At that time, we were not able to ascertain the cause of death. The cardiac arrest is a general term that we use when there's a problem with the cardiac circulation.
While admitting that Nairobi's public hospitals are overstretched due to high patient influx, Sakaja cited the ongoing efforts to improve capacity through the revival of stalled health infrastructural projects. These include the completion of a new wing at Mama Lucy Kibaki Hospital and completion of Mutuini Hospital with 120 and 400 bed capacity respectively, even as senators questioned the timelines.
That had already been done during NMS. And then there is a pending certificate that needed to be paid, which is why the contractor is not on site. So that is what I'm saying. We already have a budget in this current financial year to pay the contractor so that he can be able to complete the project.
Now hold it there. At what stage are we in this financial year? Isn't quarter one over? Yes. Was that money in the budget in quarter one? And why was it not paid in quarter one?
Secondly, Chair, you are saying you're going to re-advertise the project, because the indication from the governor was that there's already a contractor on site and he knows the name of the contractor.
Chair, let me help the officer, because I'm the one who signed the response.
Okay, but
I have the full responsibility.
And just take it. You know, these are the things we said. We are not going to allow people who will be coming to this committee to give us shoddy answers.
Currently, public hospitals in Nairobi County have a capacity of 46 ICU units, 18 at Mama Lucy, 10 at Mama Magnet Uhuru, 8 at Mbagathi Hospitals, and 10 more nearing completion at Mutuini Hospital. Kamche Menza for Prime Edition.